Hey everyone, my name is Molly Day, and I chose to do my master's project on benign prostatic hyperplasia because I am interested in urology and the diseases surrounding it. Today we're going to talk about benign prostatic hyperplasia, also called BPH. In this PowerPoint, we will go over the basics of BPH, how a patient with this disease will present, how to diagnose it, treatment options, and some tips for patient education. Let's start by talking about the etiology and pathophysiology of BPH. This is a very common, non-malignant medical problem that occurs in men of increasing age. About 80 to 90% of men in their 70s and 80s will experience problems associated to BPH. BPH is defined as an increase in the number of both the glandular and the stromal cells that are located in the transitional zone of the prostate. When a patient becomes symptomatic with BPH, they will likely experience symptoms that become quite bothersome and disruptive to their daily lives, causing them to present to a healthcare professional or to a clinic. These symptoms include urinary frequency, urgency, hesitancy, straining when urinating, and dribbling. The physical exam for BPH requires the provider to first just do a general examination and get an overall feel for their patient. This includes assessing things like their body mass index, their lower abdomen, and external genitalia to rule out other possible diagnoses. The more specific physical exam technique used in BPH is a digital rectal examination. So this is done by palpating the prostate gland via the rectum. This can clue the provider in on the size, the texture, and any tenderness that may be in the prostate gland. When it comes to diagnostic studies for BPH, there are two labs that can be helpful. First, a urinalysis is used to assess for infection, blood, proteins, or sugar in the urine that could be causing the symptoms. The other lab used is called a prostate-specific antigen, or a PSA. This is a small protein produced by the cells in the prostate, and when the prostate size is increased, this lab value typically increases. While not used as commonly as these lab values, an ultrasound is sometimes used by providers to assess the prostate as well. This is done in an outpatient setting. It's not invasive, but it is not routinely used. The treatment for BPH involves multiple approaches. First and foremost, providers start by encouraging behavior modifications that can improve the symptoms for their patients. So these include restricting fluids before bed, decreasing the amount of caffeine and alcohol in one's diet, and double voiding. Pharmacologic agents have also been proven to be highly effective in the treatment of BPH. The first-line treatment is an alpha-1 adrenergic antagonist, or also called an alpha blocker. These drugs work by relaxing the smooth muscle in the prostate to help relieve the symptoms. Another class of medications used are the 5-alpha reductase inhibitors. These reduce the volume of the prostate and help with the disease process, but they take longer to show improvement of symptoms. Surgery is rarely used for the treatment of BPH, but it can be performed as a last resort. So while this disease cannot be prevented, there are some things that can help patients manage their BPH more effectively. This includes the previously mentioned behavioral modifications on the last slide. In addition, complications from BPH are rare, but they can still happen. Providers should educate their patients on this to ensure that they know the signs and symptoms to watch for and when to go to an emergency room. The most common complication to occur is acute urinary retention, where a patient is unable to empty their bladder. This can lead to kidney damage, so patients should seek help immediately when experiencing these symptoms. So here is a list of my references, and I hope you learned something today about BPH. Thanks for listening.